Come in.
Hello, my name's Katie and I'm going to be your nurse today. First, I'm just going to pull this curtain to and provide some privacy. How are you doing?
I'm doing fine. How are you?
I'm doing good, thank you. I'm just going to perform some hand hygiene before we get started. And first, can you just verify your name and your date of birth for me?
Joel D. Floyd, 62785.
Alright, I'm just going to check that wristband really quick, make sure I've got the right person. And the doctor has ordered some vital signs on you and a cardiac and a respiratory workup. Is that okay if we get started?
Sounds good.
Alright, now first I'm going to take your blood pressure. And your feet flat on the floor. And what does your blood pressure usually run?
About 120, 125.
Blood pressure is good. It is 118/84. And I'm just going to get your heart rate. Heart rate is 74, and I'm just going to keep on listening. And your respiratory rate is 16, so that is really good. And can I see your other hand and just observe your radial pulse on this arm as well? Alright, radial pulse appears to be at a 2+, so that's normal, that's good. And are you in any pain today at all? Alright, well that sounds good. Do you mind if I just take a quick listen to your lungs?
Can.
And I'm going to start with your right upper lobe. Just take a deep breath in and relax it out. Another deep breath in and relax it out. And without moving my stethoscope, I'm going to go to the left upper lobe and listen. Just take a deep breath in and relax it out. And I'm going to move down and I'm going to go to your left lower lobe. Just take a deep breath in and relax it out. And for the privacy of our patient, we don't ask you to take your clothes off, but if this is for real, that have to be on your bare skin. And I'm just going to move over without picking up my stethoscope to the right mid lobe. Right. Breathing appears to be regular, non-labored, so that's good. Everything sounds normal. And I'm just going to get you to take your right arm and cross it over your left shoulder. I'm just going to listen to your right lateral side. breath in and relax it out. I'm going to get you to do the same thing. Just cross your other arm over the shoulder. You can put your other one down if you like. Sounds good. Then I've already listened to your anterior and your lateral side. I'm just gonna, this isn't the best angle, but I'm gonna listen to your posterior. So first we're just gonna start. And this is your left upper lobe. Without picking up my stethoscope, I'm going to move over to the right upper lobe. And again, this is posterior. I'm going to go down to your right lower lobe. And then again, I'm going to come over to your left lower lobe. Deep breath in and relax it out. Again, everything will be regular, normal, and non-labor. You can lay back in the bed if you'd like. We're just going to pretend you're at a 45-degree angle, and we're going to get started on that cardiac workup once I just note these vitals down. Have you been having any cough lately? Has anything came up at all?
Yes, ma'am.
And what color is it?
Green.
It's green.
Lots not.
Oh, goodness. Well, I'm going to make a note of that in your chart, and I'll be sure to let your provider know. And first, we're going to go over, we're just going to pretend that this is a spirometer. And what you're going to do is you're just going to take a deep breath in about 3 to 5 seconds. 2 to 5 seconds. And we want you to do this 10 times in hours. Do you like to watch TV?
Somewhat.
So whenever you do, to kind of help you, whenever the commercial comes on, you're just going to take this and use it whenever the commercial. You just want to breathe in for about 2 to 5 seconds, a nice deep breath. And this is going to help expand those lungs and get them moving, okay?
Okay.
And can you repeat what I just said, just to be sure you understand it?
3 to 5 times.
2 to 5 times. 2 to 5.
Excuse me, 2 to 5 times an hour.
I'm just going to lay this over here beside the bed. That way you'll know. And let me just see your hand really quick. We're going to start with the left. I'm just assessing that capillary refill. Excuse me. This is your right side. Right capillary refill of less than 2 seconds, so that's really good. And let me see the left. Left capillary refill of 2 seconds as well. So normal bilateral capillary refill at less than 2 seconds. And let me just look. No jugular vein distension present. And we're going to start distal and go to proximal. I'm just going to observe any edema or swelling you've got going on in your arms, which appears to be none. And let me just get your left side. So no bilateral upper edema noted. I'm just going to move on down here to your feet. Is this okay?
You like feet?
I don't, but it's a part of my job. No edema noted in your feet. On your left, I'll move over. Your right, I'll move over to your left. No edema in the left. Now I'm just going to observe your dorsalis pedal pulses. And they appear to be normal at a strength of 2+. Now we're going to go to that tibial pulse, posterior tibial. And those also appear to have a strength of 2+ as well, so that's good. That's normal. So So your radial, your dorsalis pedis, and your posterior tibial are all at a 2+, which is good. That's where you want it at. It's in range. And do you mind if I take a quick listen at your heart? Again, we're just pretending that you're at a 45-degree angle.
Sure.
Well, I'm going to start at your left second intercostal space, your right intercostal space, and this is the aortic. Without picking up my stethoscope, we're going to move over to the second left intercostal space. This is your pulmonus. Moving down, we're going to go to the third intercostal space. And this is your Erb's point, or your second pulmonus. And then we're going to move on down to your fourth intercostal space. Again, we're still on the left side. This is your tricuspid. And then we're going to move over to your fifth intercostal space, again on your left side. And this is also called your apical or your apex, also the point of maximal impulse. If you were a woman, I'd ask you to lift your breast up, or I could do it for you if you were okay with that. Everything sounds good. I'm just going to notate that in your chart. Have you been having any chest pain or shortness of breath at all?
Yes, ma'am.
When do you feel short of breath?
When I'm getting up and down.
Whenever you're getting up and down? Is that whenever you get up and down out of the bed?
Yes, ma'am.
I'm just going to notate that in your chart. And again, that's the only time that you feel short of breath?
Yeah.
Alright, well perfect. I've got everything in your chart, and thank you so much for allowing me to do this on you and be your nurse today, okay?
All right, thank you.
You have a good one.